We will jump right into recording. Thank you. Go ahead.
Okay. All right. Okay. Well, good morning, everyone. Thanks for joining me. I am Aaron Alexander. I'm an environmental health specialist with the Indian Health Service. I'm stationed here in Sacramento, California. Our main role, kind of what we do is usually we're doing our routine surveys, mainly find me in the casino kitchens, things like that, doing our annual inspections. But we kind of get into these other topics to provide technical assistance to the tribes. So today I'll be talking to you guys about wildfire smoke information, specifically focused on for healthcare providers, and kind of talk about some resources. Okay. So yeah, just a quick overview of what we're going to talk about today. First, we're going to cover the different components of wildfire smoke, and kind of what makes it so harmful. Next, we're going to talk about populations that are highly susceptible to wildfire smoke exposure. We're going to then dive into specifically particulate matter 2.5 exposure health effects. We're going to cover some recommended interventions for healthcare facilities, things to implement. Specific strategies to reduce exposure. What you advise your patients to do to reduce their exposure. And then finally talk about some specific resources for providers to get more information. But yes, the training should last approximately 30 to 45 minutes with some time for Q&A at the end. So first, we're gonna again talk about wildfire smoke components. Dive into that. So yeah, wildfire smoke is a mix of small particles, gases, and water vapor. The harmful components include carbon monoxide. So that's a colorless, odorless gas, and it's a combustion byproduct. Exposure to carbon monoxide can include headache, dizziness, fatigue, shortness of breath, blurry and double vision, chest pain, and nausea. Next is ozone. So that's produced mainly in smoke plumes during wildfires. That can exacerbate asthma symptoms, COPD, and cause coughing, throat irritation, and congestion. Next up is your volatile organic compounds, or VOCs, such as formaldehyde. Again, similar symptoms, except those VOCs can cause more systemic effects in the liver, kidneys, and central nervous system. Again, those are kind of not really of main focus of wildfire smoke exposure because they're in smaller amounts and not usually causing symptoms in terms of wildfire smoke. What we're mainly focused on is particulate matter, and it comes in two types based on the size of the particles. So there's PM10, which are particle size between 10 and 2.5 micrometers in diameter. And finally, PM 2.5. So these are particles that are smaller than 2.5 micrometers in diameter. And this size of particle makes up about 90% of wildfire smoke particle mass. So yeah, these are the smallest particles, but they are what we're most concerned about in terms of wildfire smoke exposure and the health effects from them. So in this diagram here, you can see the size comparison. That's a piece of human hair right there. And yeah, so they're very, very small particles. So yeah, wildfire smoke concentrations, just to give you an idea of how, hard it is to predict if you're going to be affected by wildfire smoke. It can travel hundreds or even thousands of miles. And there's many uncontrollable factors that contribute to the smoke concentrations in your area, such as wind direction, speed, weather, terrain, the proximity to the fire, and also the time of day, can affect your smoke concentrations. Yeah, so this emphasizes the importance of preparedness, even if you're not in a wildfire-prone area. So, for instance, this picture here, New York City, you don't really hear about fires, but there was some large fires in Canada that caused smoke to travel. They were seeing wildfire smoke in New York City, even. So next, we're going to talk about highly susceptible populations, or what will be called sensitive groups, in terms of like some of the monitoring resources that are out there. They'll use that term, sensitive groups. So some of our different sensitive groups are, of course, children, because their lungs are still growing and they have faster breathing rates. And due to their smaller size, they have a higher inhaled concentration of smoke particles versus adults with the same environmental exposure. Next up is older adults, because older adults have a higher prevalence on lung and heart disease, and they have a higher chance of undiagnosed disease. So they're a sensitive group. Individuals with chronic respiratory or cardiovascular disease, again, we'll talk about later why, but yeah, wildfire smoke aggravates these diseases, so it puts them at higher risk of hospitalization and medication usage as well. Next is pregnant women. So pregnant women, due to the physiological changes during pregnancy, they have higher breathing rates and more blood volume, cardiovascular output. And so, yeah, again, it causes more inhaled particles into the body. And finally, another one that most people don't think about is people of lower socioeconomic status. Because again, due to the higher cost of running utilities like air conditioning, and the cost of like HEPA air purifiers, portable purifiers, and generally less access to medical care. This puts them at higher risk for more severe symptoms during wildfire smoke events. Okay. Just a quick deep dive. So this is kind of some of the causes or kind of why PM 2.5 is so harmful and wildfire smoke events. So it causes increased reactive oxygen species in the body, which leads to cell damage, cell death, carcinogenesis. It also causes inflammation. The IL-6 response causes a cascade effect and other inflammatory factors leading to cellular damage. And then again, yeah, cell apoptosis, cell death, because it causes mitochondrial dysfunction and upregulates production of apoptosis-related proteins. So these are kind of some of the mechanisms as to how PM 2.5 harms the body. And as far as how becomes systemic, so PM 2.5, it's small enough to get past our body's defenses and get all the way down to our alveoli, where the gas exchange occurs, and it can get into the bloodstream, and again, it causes those systemic effects. So, and also because it gets so far down into the alveoli, it damages the tissue in the lungs, and it causes scar tissue buildup, which then, yeah, causes cardiovascular and respiratory effects as well. So just go over some of the health effects. So short-term exposure over a few days. A community might see this during a wildfire event. So in healthy adults and children, usually they'll see just eye, nose, and throat irritation, coughing, chest tightness, very acute symptoms that, go away as soon as they remove themselves from the exposure. Whereas sensitive groups that we talked about earlier, they'll have those aggravated lung disease, develop acute bronchitis, and asthma attacks, heart attack, heart arrhythmias, and stroke. Just again over a few days of exposure, depending on the concentrations, which we'll talk about later. So cumulative short term. So this is kind of what you would see exposures in like wildland firefighters, who are kind of staying in base camps and things like that, who might be exposed to different amounts of concentrations over multiple days to a few weeks. They have seen some studies done where they saw reduced lung function. So this is mainly seen studies done on like people who live in metropolitan areas where they can kind of see high amounts of air pollution. Again, yeah, reduced lung function, chronic bronchitis, and even premature death. And there's one study done that saw that air pollution shortens lifespan by 1.5 years on average throughout the USA. So next, yeah, I'll go into some of the specific sensitive groups health effects. So individuals with asthma and respiratory disease, in wildfire smoke events, they may see breathing difficulties such as coughing, wheezing, and chest tightness, exacerbation of asthma and COPD, department visits, and hospital admissions. And again, in children specifically too, there is a higher risk for asthma attacks. as well, highlighting the importance of those asthma action plans, things like that. So there's a few studies done. The CDC and the EPA performed an assessment of asthma emergency department visits in the US during the Canada wildfires in 2023, and they saw that emergency department visits were 17% higher during those 19 days of wildfire smoke than expected. Then also another study in 1999, this was actually done in the Hoopa Valley tribe. They saw a increase in respiratory illness visits, a 52% increase during the weeks of an active forest fire. So yeah, numerous studies done that show that you get those increased hospitalizations and ED visits during smoke events for respiratory disease. So next up, individuals with cardiovascular disease. So you'll see triggering of those ischemic events, the narrowing blockage of the blood vessels. So you'll see the angina, heart attacks, and stroke happen because of that. Worsening heart failure, abnormal heart rhythms. Yeah, so and then also for pregnant women, there is a higher risk of preterm birth and lower birth weight in unborn babies. So this is largely seen too in exposures during the third trimester. So it's similar to the effects of smoking commercial tobacco during pregnancy, which makes sense because it's similar contaminants. But yeah, so yeah, increased risk for pregnant women as well for preterm birth weight. So this is a new kind of emerging topic, especially here in California. You can see the dates of these studies are fairly recent. So they're kind of looking into the synergistic health effects with extreme heat. So in California, yeah, some Southern Cal cities are seeing 25 high heat days per year. So this is going to be, with climate change, it's going to continue being an issue, especially here in California. So there was Rahman et al. In 2022. They saw that there was an increased mortality risk by over 21% on days with both particle air pollution and extreme heat. And that effect was largely seen in patients over 75, again, or elders who are high risk. Next is Jones, sorry, I don't know how to pronounce that, Go et al. 2025. Again, they also saw that there was an increased hospitalization with only 4 days of co-exposure. So again, like we saw, 25 high heat days in California, only 4 they saw increased hospitalization. So yeah, it's going to continue being an issue. So next we'll go into some of the recommended interventions. So these are kind of like for your healthcare facility, some considerations to put in. So a big one I recommend doing is, so there's this document from AmeriCares. I have it linked in here, but it's to help establish a wildfire action plan with your high-risk patients. So this plan kind of ensures patients understand the risks present with wildfire smoke, assess their ability to read and access air quality information and understand it. Part of it's a home assessment. So your CHRs now treat staff. They can use that home assessment to identify air pollution sources and create a plan for their specific environment to reduce their exposure to wildfire smoke. And also has a tailored plan for each air quality category, which we'll talk about later, the EPA's matrix. And yeah, create a tailored evacuation plan as well for different AQI categories. So that's a very useful one from AmeriCares. Next is to establish a communication plan. So this plan should outline who should be given specific information, such as if you want to do targeted messaging to your schools, nursing homes, and high-risk patients within your care. Next is what information will be provided. Are you going to be providing, shelter information, air quality information, information on strategies to reduce exposure, things like that. When, so if you can set your threshold of whenever the AQI is above 50 or above 100 in your community, this is when you're going to deliver information, and also the channel. So social media, radio, door to door, things like that. Just have that outlined in your plan. and when to implement it. Some other ones, so HEPA air purifier distribution program. So these are the portable HEPA air purifiers. This is a good program to prioritize, like with your high risk patients. When you're doing those home assessments, you can see if if they have need for one of these. So a good thing with these two is also to provide some sort of education material with it. So the EPA has this guide to air cleaners in the home that kind of goes over sizing and where to place it, like that, avoid placing them in corners of the room, things like that. Which is actually how it's pictured there. But anyways, but yeah, so it's good to have that information to go with it. You don't just want to hand them a purifier and then not educate them on how to use it properly. Next is N95 distribution. This is kind of a mixed feelings on this because it is technically PPE, and PPE is not very a reliable control, but I think it's better than nothing. So if you have your N95 distribution and again include an educational component with it. So again, the EPA has a handout document that you can print out, and it teaches you how to properly don the mask and wear it. Yeah, again, N95 shouldn't just be given to everyone, because they do restrict your breathing rates and things like that. Patients with cardiovascular respiratory disease shouldn't wear one unless okayed by their doctor. So that's something to consider as well with that. Yeah, and always when you're giving them an N95 respirator, advise patients that if they have trouble breathing while wearing it, if they start to feel dizzy, faint, or claustrophobic, to remove it and go to clean air. So next up, yeah, so like we talked about earlier with, the increased ED and hospitalizations visits for wildfire smoke events, you want to monitor your healthcare capacity and plan for a surge due to asthma and COPD and cardiovascular disease. So kind of like include that in your emergency plans to plan for surges during these events. Again, you want to counsel patients on strategies to avoid, so specific strategies like staying indoors, monitoring your local AQI information, yeah, locations of clean air shelters, things like that. And then, yeah, counsel high-risk patients to monitor their symptoms and to keep at least a 1 week, they say 7 to 10 day supply of their medications on hand in case they need to evacuate or can't leave their home to go get their medications refilled. Does anyone have any I know we only have one. Does anyone have any questions so far? I'm kind of cruising through this here, but no. Okay. So next we're going to kind of dive into some of the specific strategies to reduce wildfire smoke exposure and health effects. So yeah, dive into that. Again, so these are kind of things you want to help advise your patients on. But yeah, so first one is to monitor your air quality. So first, just to kind of, for those who don't know, if you live in California, I think everyone pretty much knows this. This is the EPA Air Quality Index. So it was a tool developed by the EPA to communicate the levels of contaminants in the air. The EPA does monitor 5 major air pollutants: ground level ozone, particulate pollution, which is what we're concerned with wildfire smoke. They also monitor carbon monoxide, sulfur dioxide, and nitrogen dioxide. So when you're looking at this air quality index for wildfire smoke, you want to make sure you're looking at PM 2.5 levels, and it's reporting that. So yeah, it's color coded from green to maroon. So maroon is the hazardous, it's AQI 300 or higher. Good is 0 to 50, moderate is 51 to 100. Unhealthy for sensitive groups is 101 to 150. Unhealthy is 151 to 200. And very unhealthy is 201 to 300. So each one of these different categories is going to have different recommendations for the different healthy individuals and sensitive groups. We'll see. So the preferred resource when you're looking at monitoring air quality information is to go to your local air quality management district. So if you go to that link in the slides, you can look up your county in there, and that's going to have tons of resources for you when you go to those specific air quality management districts. Not just wildfire information. It's going to have shelter information, things like that. Next for monitoring is the fire.airnow.gov. They just recently updated to the 4.1 map. It's really nice. It'll show you the most current PM 2.5 levels in your area. You can click on the specific monitor and it'll show you trend data, and pretty much everything you need to know for air quality information. So next is this one's more of a warning slide. So I remember back early COVID, this purple air monitoring was pretty popular. But yeah, so I just wanted to warn you. So this purple air uses low cost sensors. Pretty much anyone could buy one and put one up at their home and it would record data to the site. So the purple air monitors were not accurate when the readings were above 150 AQI. So I always recommend now everyone just go to that fire.airnow.gov site because they actually take the data from the purple air sensors. They use those low cost sensors now, that data, but they actually correct for the instrument error. So the fire.airnow.gov is more accurate information to use now. So yeah, next is I like these ones. So if you do again go to that fire.airnow.gov, you'll see these blue boxes around fire areas. And that'll link you to this information. This is the interagency wildland fire air quality response program. So this pulls up a sheet for that area within the box, and it'll give you all these different cities, if you see this very well, but it'll give you trend data for specific communities within the fire area. It'll give you information on the smoke and the fire. So again, super useful tool for monitoring and planning for your communities. Next is another resource for monitoring. So this is the California Smoke Spotter app. It's fairly recent. I think within the last couple of years it came out. But again, this allows you to ping a specific location on the map and it'll give you 72-hour smoke forecasts, maps of fire locations, and it also sends you alerts for those. So if you have like an elder not living with you and you just want to ping their location just to monitor for them, that it's a useful tool for that. So yeah, next we're going to dive into the different levels within the AQI categories. Again, yeah, but so it's good to from this you should just know what to communicate to your patients and also what to include in their wildfire action plans for these different AQI categories. So when the air quality is moderate, that's at 51 to 100, it's the yellow category. Usually healthy individuals aren't going to see any symptoms within this AQI, but unusually sensitive people should start to consider taking it easy and monitor their symptoms. So next, when it jumps up to 101 to 150, this is when it's unhealthy for sensitive groups. So yeah, sensitive groups should start to reduce their outdoor activity. And then this is when people with asthma should start to follow their asthma action plan. So yeah, children that go to school are usually required to have these. Yeah, so just follow the plan and then watch for symptoms such as fatigue, shortness of breath. So next one, the air quality jumps up to 151 to 200, where it's the red category. This is when you want to start kicking in those specific strategies, such as keeping your windows and door closed at home, making sure your home's weatherized to prevent smoke infiltration. Start using your air conditioning in the recirculate mode. If your home can handle the filter, to use a MERV 13 rated filter on your home. And again, yeah, avoid generating those indoor pollutants to, reduce as much contaminants in your air as possible. yeah, this is when you want to start using your portable HEPA air purifiers, if you have one. So next, when it's very unhealthy air quality, so when it's 201 to 300 in purple, sensitive groups should avoid all outdoor activity. Healthy people should avoid exerting themselves. So this is when, if you're a healthy person, you should stop running outside and spend more time indoors. Say when hazardous AQI 301 to 500, everyone should just avoid outdoor physical activity. And then wearing an N95 respirator if you need to go outside. Um, yeah. So next up, I'm going to talk about HEPA air purifiers. So you always want to make sure that they are CARB certified. That's the California Air Resource Board certification. It just ensures that the HEPA air purifier meets electrical safety standards and also ozone emission standards. Some they're called like ozone generators. Not recommended because again, ozone we saw can cause headaches, dizziness, things like that. So it's good to get a CARB certified device so you're not getting exposed to unnecessary ozone. Um, for sizing, you want to make sure the advertised square footage meets or exceeds the room. Um, some air purifiers have what's called the clean air delivery rate advertised. For that, you just want to make sure you're looking at the clean air delivery rate for tobacco smoke and make sure that the number is at least 65% of the room size. So if you have a 150 square foot room, you want to make sure the CADR is 100. And that's the way you size it with the clean air delivery rate. Again, so filters, you want to advise patients to make sure they have enough filters on hand. If they're getting a lot of smoke infiltration into their home, they might need to change their filters out more necessary than the manufacturer's recommendations. Maybe even like weekly. Um, but yeah. So yeah. So next, these got really popular again during COVID as well when there was a shortage of purifiers. So yeah, the DIY air purifiers. So what it is you use a box fan, and then you have some sort of fastening device, either a cable or tape or some clamps. You literally stick a MERV 13 filter directly onto the box fan, and then it acts like a HEPA air purifier, and they work very well. You just want to make sure that the box fan you're using is a newer model than 2012. Because before that, they didn't have the same electrical safety standards, and you can actually cause fires because of, overworking the motor with the filter installed. Um, yeah, again, same thing. Make sure you have extra MERV filters on hand because during wildfire smoke, they become dirty faster. So they might need to be changed every week or every few days. So yeah, again, for extreme heat and wildfire smoke, it's a good idea to work with your communities to open up a cooling center or a cleaner air shelter. So these are usually at, public facilities like libraries, community centers, indoor swimming pools. And yeah, so they should have access to air conditioning, food, water, and yeah, and you want to advise patients always to, if they don't have good weatherization at their home or they don't can't run their air conditioning all day, have them plan to spend the hottest part of the day or when the air quality is, 150 or higher, spend it at these locations and linked into those resources. Okay. Okay, next we're going to dive into some of the specific provider resources. So the first one, the Wildfire Smoke Guide for Public Health Officials. This was developed by CDPH and the California Air Resource Board. It's a very extensive document, very useful. It has 5 chapters, pretty much broken down exactly how this presentation went. yeah, it's a very good resource. Has pretty much everything you would need for wildfire smoke information. Next is the EPA online training for health professionals. These are specific trainings offered by the EPA. So yeah, wildfire smoke in your patient's health, particle pollution in your patient's health. And then there's also links to other healthcare professional resources on there. Again, good resource for healthcare providers. So another one is the wildfire smoke considerations for California's public health officials. So yeah, it contains a lot of user information, such as information on conducting a community vulnerability assessment. And also the Appendix B in this document has tons of links to resources from a wide range of sources. So very useful. Next is the Western States Pediatric Environmental Health Specialty Units. There's tons of resources on here as well, specifically aimed for children and pregnant women. And they have tons of like handouts and additional links to resources for that. So again, yeah, very awesome resource. So next, some resources that we developed. So yeah, the California area DHS, we developed a cleaner air shelter guide and also a guideline for opening a cooling center. You can just reach out to us. We'll be happy to provide these. Again, just it lists out some different considerations to have when you're setting up your shelters. We also developed the smoke readiness plan. This I highly recommend for healthcare facilities. We'll talk about it right here in the next slide. So your system capabilities for your HVAC. So yeah, checklist one is used by like a HVAC technician to determine your system capabilities, such as what MERV rating your system can handle, and settings for reducing outdoor air infiltration, such as like maintaining positive building pressure, and things like that. That's kind of part of what it looks like. I just took a section off of it, but and yeah, part two of it ensures proper weatherization. Um, and then part three is actually an inventory sheet to help maintain your filters and your other inventory through wildfire smoke season. So it has things like a decision matrix as well, on when to start implementing your plan and how to prepare for wildfire smoke season. So again, here's contacts for environmental health. IHS Environmental Health in California. Our Arcata and Reading office are currently vacant, so they're being serviced by me in Sacramento and also my colleague Troy Barker over in Ukiah. But yeah, reach out to us. We're happy to send, any technical assistance on this topic. And also we during wildfires, we are available to perform assessments of emergency shelters, clean air shelters, and mass feeding operations. And we also have a stash of N95 respirators and HEPA air purifiers. An emergency stash for those. I think we're getting about 75 this year, but yeah, those are based on need, and they're also prioritized for high-risk patients when we deliver those out. But yeah, any questions? Mhm. Sorry, I went pretty fast. Usually I put in some time for some questions throughout the thing, but